Yes, welcome my subscribers. Thank you for subscribing on my YouTube channel. Those ones who have not subscribed, subscribe, put on a notification, and we continue to enjoy as we learn. Yeah, today we are going to look at this kind of drug you're seeing here. It is under the brand name of Sildenafil. Some companies, mainly the Pfizer company, calls it Viagra. Other companies call it penegra. This drug, it has clinical use and it is of clinical importance, and we prescribe it to many patients because of its benefits. But again, the same drug is related to many other complications and serious adverse effects, as we are going to see. We are going to see the mechanism of action of this drug. How does it work when it is in the body? And we are going to look at those adverse and serious reactions that come from this drug. First of all, to begin with, sildenafil as a drug, we use it to treat several conditions. One of them, and the first condition that was being treated using this kind of drug, is the pulmonary arterial hypertension. But later on, scientists sat down and realized that they can use this same drug because of its effect, as we are going to see its mechanism of action. They can use this same drug to treat erectile dysfunction, to increase stimulation, sexual stimulations, to treat premature ejaculations and weak erections in men. So we prescribe this drug in hospitals. It's available over the counter for treatment of these different conditions. But this time around, most of the people are using it as a sexual fantasy to prove their girlfriends or their wives that they have strong energy in bed, that they can make it, which is not good because of the effects we are going to look at. First of all, we are going to look at its mechanism of action. This drug is a PDE5 inhibitor. What do I mean by saying PDE5 inhibitor? It is yes, I said this drug is a PDE5 inhibitor. PDE5 is phosphodiesterase 5. So when you inhibit this enzyme is the one which is responsible for the breakdown of cyclic guanine monophosphate. Cyclic guanine monophosphate. So once you inhibit this enzyme, what is going to happen? The enzyme is not going to be in a position to break down this compound, this substance. What is going to happen? This substance is going to accumulate in your blood, mainly where the most places where we find this enzyme is in the penis and in your lungs, the pulmonary vascular system, that is to do with the lungs. So once this component accumulates there, it's going to cause vasodilation. On top of vasodilation, it is going to cause what we call smooth muscle relaxation. After these muscles relax, you have vasodilation. What is going to happen? There is going to be increased blood flow to these areas, mostly your penis, the spongy muscles of the penis. They are going to be having a rich supply of blood. More blood is going to be flowing to your penis to give you a strong and sustained erection. So it will be so stiff and strong. So you can't beat your person, you beat and prove them that you're a man. So That's how this drug works when you take it into your body. Now, after seeing how this drug works, we are going now to look at the side effects caused by this drug. When it is in your body, they range from simple side effects to complicated and more serious adverse effects. Some of the simple ones, we have dizziness, we have headache, we have stomach upset, we have you can get anemia. Those are the simple ones, simple side effects, common side effects. But there are those major serious effects of this drug you never knew. You're just using the drug for sexual fantasy. So here are they. So the serious effects, the serious adverse effects of the drug: Sildenafil, penegra, Viagra. One of them is to do with vision. If you are taking this drug, you are putting your vision at a risk. At first, you're going to develop blurred vision when you are not seeing things clearly. When you continue to use this drug, you're going to get what we call color blindness. You will not be in a position to differentiate between colors when you take this drug for so long. You will lack the ability to accommodate light. You will be having high light sensitivity. And at the end of it all, you're going to have permanent blindness. This drug can make you blind, totally blind. You cannot see anything. 2, it's going to do with your hearing. You're going to have impaired hearing. You can even lose your hearing sense, and you don't hear anything at all because of this drug. 3, you're going to develop what we call Peyronie's disease. This disease leads to development of plaques in your penis. At the end of it all, these plaques, the obstacles in your penis, are going to lead you to get what we call erectile dysfunction. You will lose your erectile function. Although we use it to treat erectile dysfunction, but for you people who use it when you can erect very well, you are going to subject yourself to getting erectile dysfunctions. The serious one is what we call priapism. Priapism is sustained erection. You will erect indefinitely, and you end up taken to the theater for surgery. You erect indefinitely minus coming by minus cooling. You end up being taken to theater to relieve this sustained erection due to this drug. So as you are using this drug, be vigilant of these effects. Thank you very much.